This is the first of many briefings, and I look forward to speaking with you often, updating you on the state of the pandemic, and sharing continued actions that the public can take to protect themselves and their loved ones. Let's start with an overview of the data. There are some hopeful signs that we are watching very closely. 25.1 million COVID-19 cases have been reported to the CDC through January 25th. During the week of January 19th through the 25th, the 7-day average of new cases decreased by 21% to over 166,000 per day. During the week of January 18th to 24th, the 7-day average of new hospital admissions of patients with COVID-19 also decreased by 15% to nearly 13,000 per day. However, over 78,000 patients were hospitalized with COVID-19 as of January 24th. 419,827 deaths have been reported since January 22nd, 2020. During the week of January 19th to January 25th, the 7-day average number of deaths decreased by 4.9% to 3,113 per day. And while these data are trending downward is a good sign, the number of deaths reported in a single day during the outbreak was reported on January 20th, the peak number of 4,383 deaths. Though I am encouraged by these trends, our case rates remain extraordinarily high, and now is the time to remain vigilant. If we continue in the current trajectory, the CDC most recent national ensemble predicts that 479,000 to 514,000 COVID-19 deaths will be reported by February 20th, 2021. I know this is not news we all want to hear, but this is something we must say so we are all aware. But if we are united in action, we can turn things around. Continuing to expand safe, effective vaccination is key to ending the COVID-19 pandemic and bringing our country back to health. Daily vaccine doses administered continue to rise to more than 1.6 million doses per day over the past week. Over 23.5 million doses of COVID-19 vaccine have been already administered. This includes 3.4 million people who have already received their second dose. I want to take a moment here to emphasize that the COVID-19 vaccines are safe and they work. And this is backed up with data that I would like to share with you. Last week, the CDC released an MMWR on severe adverse events, most notably anaphylaxis, for those receipt of the Moderna vaccine as well as the Pfizer vaccine. Based on our most recent data, we found that there were 2.1 cases of anaphylaxis per million administered doses of Moderna and 6.2 cases of anaphylaxis per million doses administered of Pfizer. Let me be clear, these are rare, treatable outcomes, and the COVID-19 vaccines are safe. It's also important to put this into context. The risk of getting sick with COVID-19 are much higher than the risk of allergy or anaphylaxis from the vaccine. In the US, sadly, approximately 16,500 people for every 1 million who are diagnosed with COVID will die. And while anaphylaxis can be scary, there are effective treatments and patients generally do quite well. It's also important to note the mild side effects, like pain where you got your shot, feeling feverish or tired, and muscle aches after getting your shot. These are all normal and expected part of getting the vaccine, especially the second dose. And these symptoms mean that your immune system is revving up and the vaccine is actually working. CDC is actively monitoring for safety signals associated with these vaccines, and we are committed to sharing those safety data with you as they emerge. Also last week, CDC updated guidance to reduce barriers associated with returning for a second vaccine dose on a specific date, or when circumstances change between a first and second dose. There are two important updates that I want to clarify. First, in our updated guidance, the CDC still recommends that people get their second dose as close to the recommended interval as possible. That would be 3 weeks for the Pfizer vaccine and 4 weeks for the Moderna vaccine. However, we also know that life can get in the way and that some of those doses may be missed in the best time window. And in those rare circumstances, the second dose may be given up to 6 weeks or 42 days after the first. Second, the CDC has reiterated that the COVID-19 vaccines are not interchangeable. However, it's also true that in extremely rare circumstances, people may not simply remember or have documentation of which first dose they received. In these extremely rare situations, we have said that any available mRNA COVID-19 vaccine may be administered as the second dose if people are unaware of which first dose they received, and that would be at least 28 days after their first. I also know that there are concerns about variants. Viruses mutate, and we have always expected that variants would emerge, and we have been looking for them. The variants have been identified recently seem to spread more easily. They're more transmissible, which can lead to increased number of cases and increased stress on our already taxed healthcare system. In the United States, 308 cases of B.1.1.7 variant that originated from the UK have been confirmed in 26 states as of January 26th. We also identified this week our first case of the P1 variant in the United States in Minnesota. To date, no cases of the B.1.351 variant that was first detected in South Africa has been identified in the US. CDC is committed to working with international and state and local partners and increasing surveillance to monitor the situation and share as soon as we learn more. The emergence of variants underscores the need for public health action. First, get vaccinated when it's your turn. Also, some people may need help getting vaccinated. Please consider helping your neighbors and loved ones schedule or travel to their appointments. Second, wear a mask, practice social distancing, and wash your hands. And finally, now is not the time to travel, but if you must, be safe and follow the CDC guidance. This includes wearing a mask as well as testing and the quarantine protocol. Please do your part to get cases down by simply taking these actions. Thank you.